Late Night Health continues. We're not going to Australia. We're going to Malibu instead.
It's a little closer.
A little closer, and I won't get jet lag, but that's okay. We're going to be spending some time with Dr. Damon Raskin. He's an internal medicine, has board certified in internal medicine as well as addiction medicine, which is a fairly new board. And he works with Cliffside Malibu, which is a gorgeous place, you know, here in Southern California. Dr. Raskin, welcome to Late Night Health.
Well, thank you so much for having me.
We were going to spend some time with Constance Sheriff, who is a research fellow at Cliffside, but you are an able substitute.
Well, thank you. I appreciate that.
We want to talk about marijuana. Here in California, 9 other states, there are ballot issues allowing for the legalization of marijuana.
Yes.
What is yours and Cliffside Malibu's thoughts about legalizing marijuana?
Well, I think my view as an internist as well as addiction specialist, and I think the view of most of the doctors over at Cliffside Malibu and the practitioners there see this as a bad idea. And the bad idea is because this is really sending the wrong message to society that this substance is safe, that this substance is okay, that there are really no long-term consequences, and that's really not true.
We tried prohibition, okay?
Yeah.
And while it was many years ago, it didn't work, and they repealed it. I mean, and that was against alcohol. During that time, many people made lots and lots of money. The Kennedy family, Seagrams, I mean, and, you know, they started with booze. And we know that alcohol is it's awful. We hear about, you know, car accidents, other accidents with alcohol. Daryl has had experience, my partner, with alcohol.
When I went through rehab, it wasn't as pretty as Cliffside Malibu,
right.
But it was effective and it worked. But what we talked about, obviously, was drug of choice. And just because alcohol seemed to be my drug of choice didn't mean that I could go ahead and partake in other things.
That's
an
correct.
addict is an addict is an addict.
That's right.
And, you know, you couldn't claim to be clean and sober if you weren't drinking, but you were smoking pot all the time.
That's correct.
Right. Well, but if somebody's 21 and over, shouldn't they have a right to use a drug of their choice?
Well, look, I mean, we as a society still have to send the right message, right?
Right.
So if this drug, it looks like, whatever happens, it looks like the drug's probably going to be legalized. But I think as a society, we have to send the message to the youth of our country, to the adolescents, who will then pick up on the fact that, oh, this is okay, this is safe, they've made it legal, that it's really not, and that there has to be education regarding this, that we know that there are good studies to show that chronic marijuana use starting in adolescence has a negative outcome for the rest of their lives. Our brain is not fully developed until at least 26 years old, and we know that when these kids start using marijuana heavily and chronically starting at the ages of 13, 14, 15, there's been some good research showing that there's lower IQ, there's more psychiatric disorders associated with these types of people who are using chronic marijuana use, and so it's not as safe as we once think, and there needs to be more research in this area to really look at that.
And my personal point of view, by the way, is that the brain isn't fully functional until you're 40. I that's just my own personal study.
Sure.
I think people are fetuses until that time.
Sure.
You were going to say something, Daryl?
Well, I was just going to say that, chronic drug use and irresponsibility sort of go hand in hand, right?
Right.
If you're going to be responsible, you can't chronically use a drug. You have to be selective in when you use it, like not using it when you drive, not using it at work, not using it when you have to, build something that's important, like in transportation, space-related aerospace-related programs, things like that, and just an occasional use. Like they say, if you have recreational alcohol use, is there recreational marijuana use? I just don't see that, chronic use of the drug and responsibility being used in the same sentence.
Well, that's right. And, the truth is that people think about marijuana like they think about it from the 60s and 70s, but this marijuana now, today, is a completely different drug. The THC content is exponentially different than it used to be, and we don't have the research that looks at this level of THC on the body, and I think that that's really where we need to go, is get the research so we know what this drug can actually do.
At the same time, looking at other drugs, particularly alcohol. I was at a function last night, Doctor, you might know about it, where people were drinking quite heavily. It was a religious celebration. Mm-hmm. I did not drink heavily because I don't like getting drunk. Mm-hmm. I don't like waking up with a hangover. Mm-hmm. It's, I've done it and not fun. So lots of music, lots of dancing last night, and lots and lots and lots of drinking. Mm-hmm. Everybody who was heavily drinking stayed there. It's called Simchat Torah. It's a Jewish celebration.
Sure.
Lots of fun. But everybody stayed there, okay, who was going to heavily drink. I did not. My wife did not. We drove home safely. I won't drink and drive unless I'm out for like 3 or 4 hours and eating and et cetera, et cetera. And if I don't feel right, I Uber.
Yeah.
So can't you do that, with that responsibility? The legislation that I understand is only for adults. It is not for teens.
That is correct. And, the occasional recreational use of marijuana in a responsible way is really not my point. My point is that by legalizing it for recreational use, we are sending a message that this is a safe drug, that I think that there's no problems with it. And I think that that's really the wrong message to send to our youth. And what I'm trying to get across, the point is that there are long-term consequences for heavy use, especially in adolescence, and that we need to take some measures now to prevent that and to educate people and to look at this in a very rational manner. I'm not saying that someone who's over 21 can't use this on occasional use and that becomes a problem. But this drug does have addiction potential. You used to say, marijuana can't be addicting. We definitely know that that's not true. I see it all the time at Cliffside, Malibu, that people do have withdrawal symptoms who are using marijuana on a daily basis.
Is it a psychological withdrawal?
No,
or
it's a physical withdrawal. People have trouble sleeping. They have trouble with their appetite. They have more depression when they're getting off of marijuana, when they're using it regularly, just like when they're getting off of other drugs that are even harder, like heroin, opiates, prescription anxiety medicines, these types of things. So even marijuana these days has a physical withdrawal that a lot of people are not familiar with. So it's not just a safe drug that doesn't have these types of consequences, and I think that's really what I wanted to get the message across.
Of course, and I don't disagree with that. I can't. It seems logical to me, but at the same time, if we don't legalize it, won't kids say, there's that forbidden fruit syndrome?
I think as long as we get the education out, and that piece is missing right now, I hear what you're saying, but then why are we just focusing on marijuana? Why don't we make cocaine legal? Why don't we make heroin legal? I mean, there are reasons why that these drugs have are dangerous and have a lot of physical and psychiatric complications associated with them. And I think as a society, we as a government need to protect our people with this. And I think that that's the important message here.
I remember being in health class, okay, in high school. I remember seeing a film where the high school football hero...
Coach.
No, not the coach. The kid. He and the head cheerleader went out, they had sex, and they both got syphilis. Okay? Did people stop having sex? No. When they put that warning in on cigarette packages, the cigarette companies found out that if they increased the warning on the package, more people would buy. And we know that compliance, as a doctor, 50% or more of the people don't comply.
Right.
Right? So if you were to say to me, Mark, you have a condition, I want you to take this pill every day, or you're going to die. 50% of the people won't do it.
But on the other side of the coin, though, I have to say that some good studies have shown that brief interventions, and when a doctor actually tells a patient to stop smoking, even if they're not necessarily ready to stop smoking right then, that they will take that into consideration, and that may make possibly a dent in that behavior. And as well, we know that less kids are starting smoking cigarettes these days, and probably that is because of some of the public service announcements that are around there. So I think that some of these measures are successful. Is it 100%? Of course not. And are there some people that want to do things to rebel? Sure, of course. But I think that there definitely still is that important message that needs to get across about some of these dangers.
You grew up on the East Coast?
No, I grew up here in L.A.
Oh, did you really? You went to school on the East Coast?
I went to Stanford University for my undergrad, then I went to George Washington University in Washington, D.C. for medical school.
Okay, gotcha. So I remember I even remember the name of my health teacher. And I remember, I never liked smoking. I didn't like being around it. It stank. And both my parents smoked. I remember sneaking cigarettes and throwing them out, then getting yelled at. And people die from tobacco. I mean, can we as a society say, well, you can do this, but you can't do that? I mean,
No, I mean,
I don't know the psychological. I don't know the answer. I'm just asking.
And people will die also just from overeating. They'll eat the wrong food. They know they have diabetes. They know they shouldn't be eating the chocolate cake, but yet they'll still do it. I think we as physicians and as educators still need to be on the forefront and really educate people and talk to them, and still not give up just because it's legal now or because society's taking a lax look at this. But I think that that's really where we can make a difference. It's still bringing it up, still talking to patients and the public in general about the possible consequences from using marijuana early on.
And I appreciate your time very much. Our guest from Malibu, Pacific Palisades, Dr. Damon Raskin. He's an internist and is board certified in addiction medicine as well from Cliffside, Malibu. And we appreciate your taking the time to talk to us today.
Well, thank you very much for having me. I appreciate it.
Thank you very much.
Okay, bye-bye.
I'm Mark Alyn. We've got a moment or two here to spend some time with Daryl. How do you, as you've just said that you've
I'm a recovering person,
yes,
for
over 30 years.
31 years.
31 now. Wow.
31, 32.
Yeah, something like over 30 years.
30 plus.
30 plus. Are you in favor of legalizing marijuana or not?
I'm not really happy with people that think that the free and liberal use of marijuana is okay if they're going to go ahead. If they just want to sit at home in a with black lights in a beanbag chair and pretend that they're a hippie from the 60s, I don't care. But the minute I have to start to interface with them, if they're driving or operating equipment, or I'm trying to carry on a conversation with them in the checkout lane and they're moving kind of slow at the junction, I don't want to have to deal with that.
Okay, man.
There you go. Or a talk show host.
Or a talk show host. The only guy who grew up in the 60s who didn't partake then. And I still don't. Anyway, Robert Clancy's coming up next, and we'll be back in just a couple moments. Join us at latenighthealth.com.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate a lower tax bill. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will fight for you using industry secrets that can stop any IRS actions, eliminate penalties and interest, and reduce your past tax bill so you pay the IRS less. If you owe $10,000 or more in back taxes, call the Tax Doctor now for a free IRS audit emergency review.
800-663-5107. 800-663-5107. 800-663-5107. That's 800-663-5107.